Hi, and welcome to the Revive, Thrive, and Optimize podcast. Again today, I'm excited to have my co-host, Janet Miller. Hey, Janet, how are you this morning?
Good morning, Billy. I'm excited to talk more about hormones today.
Absolutely. So last week, we kind of did an introductory, or the second part of an introductory to hormones, but I feel like there's some things we probably want to review.
Oh, absolutely. When we did talk a lot about estrogen, we got into progesterone, and I'd love to review that and then get on to some testosterone today.
Okay, awesome. So I think for the estrogen, the important things are that we're talking about, bioidentical estrogen, which is what a woman's body would make versus what I read from the package insert from what the drug companies say is estrogen, which is pregnant horse urine. And we always talk about how I talk about and teach how women don't typically need horse estrogen.
I don't want it.
I'm not sure of a case where I can think of where a woman does need horse estrogen. So there's so much confusion out there, Janet, that estrogen is dangerous and can cause the things that I read: cancers, blood clots, heart attacks, strokes, gallbladder disease. I mean, you name a lot of bad stuff when I go through that. But they're not talking about apples to apples. They're not talking about estradiol. We're talking about compounding bioidentical micronized estradiol. Completely different than what the drug companies are talking about as estrogen. And so what happens is the studies that are done, like the Women's Health Initiative, was done using the pregnant horse urine product. And so all those side effects will then get lumped into all the physicians' desk references and all the things that physicians and pharmacists would have for looking up a drug or knowing about a drug. They all get lumped together.
And they're scary.
They're really scary. So when you look at estradiol, because it was associated with an estrogen, it is an estrogen. And so in that study using pregnant horse urine, now all those side effects get lumped into estradiol's list.
And that's where all the confusion came from.
And there's really multiple pages and pages and stacks of studies that show that estradiol does not cause those things, but because of the studies on the other estrogens, they are still lumped in. So I get it when a provider or a patient is hesitant because they've heard these things or they've read these things and they see these things, but they're not comparing, again, apples to apples. They're not really talking about what we're discussing, which is compounded, micronized, bioidentical estradiol.
Which, instead of being scary, is actually very protective.
It is very protective. It's very protective of the woman's brain, the woman's bones, the women's hearts, their blood vessels. I mean, we can go through the list, but it's very protective of really everything, because think about when women are younger, of childbearing age, they have much higher levels of this, and that is typically when they have their best health, right? And that's when they're able to carry a child to term and deliver a child. So imagine the amount of good health that it takes to really be able to carry another human being to life. I mean, that's a pretty amazing thing when I think about it. And so we want to try to maintain some of those benefits by keeping the levels at amounts that make sense. And this is something that we talked about or need to talk about, is how the quote normal levels by the lab reference ranges are normal for a sick, old, diabetic, waiting to have a heart attack, waiting to have cancer woman. So we don't want to go by the levels that they would list for a lady your age or a lady my wife's age. Those levels are designed and based off the average. And in some cases, some of these levels, they just will tell you, if you dig deep enough with the labs, they just kind of made it up.
And we do want the lowest effective dose, correct?
I don't think so, Janet. No? I think if you look at the studies, we do not want the lowest effective dose.
We want more of a high.
We want the dose that works.
Okay.
And that dose will be different for every woman. That dose will be different for every woman. Okay. And while we do look at these levels in the blood And that is a way that we determine where somebody might need to start their therapy based on that. And their more importantly, how do they feel? What are their symptoms or lack thereof symptoms? But the studies really show by pushing some of the levels up, there's more and more protection. So it depends on the person. But no, I'm not a fan, and I don't think the studies back the lowest effective dose. Or you'll also see some doctors that teach, let's do the lowest effective dose for the shortest period of time. Well, the problem is, if you look at the studies, you only get the benefits when you're on the hormone.
Well, that reminds me of someone last night asked me, well, how do I know if I need hormone replacement therapy, and where do I go to check that? So blood labs, but not just labs. You said how the person feels.
Well, I think, the number one thing that we go by is symptoms. How does the person feel? How do they perform on a day-to-day basis? What symptoms are they or aren't they having? That's number one. Now, a provider like Kim, our nurse practitioner, she then is going to do the blood draw.
Right.
She has to do those things to cover to cover the basis and see where the person's levels are.
Because you do need a prescription.
And because they do these compounded hormones, according to the FDA, yes, we do need a prescription for that. I mean, that's the FDA rules. So we have to go by their rules, and we do the game. So, and I don't mean a game in a game sense. I just mean we have to play by their rules. That's where I'm going. And so then, the provider is typically going to want blood levels for that, so that they can base their therapy on the blood levels and the symptoms. But the symptom improvement, the way the person feels, is number one. And that's where I don't think the lowest effective dose is necessarily where somebody wants to be, because some of the studies show that much higher blood levels are where the maximum protection comes in. And that includes heart protection, brain protection, bone protection. Again, improvement of quality of life. The only places that I know of where improvement in quality of life, you'll see it over and over and over, is in the studies on bioidentical, compounded, micronized hormones. You don't find it in any drugs listed. And I know it is, quote, by the FDA, a drug, but remember, these are bioidentical to what our bodies would make, what your body makes. So while it is listed technically as a drug, it really is an equivalent hormone to what your body's already making. And we just need more. Most people, men and women, need higher levels to have optimal health, which is what this is all about, right? Revive, thrive, and optimize.
Right.
OptiU RX is about optimal you, and the prescription for it is typically the 5 pillars, and part of that is balancing hormones.
And what's optimal for my body might be a little bit different from someone else's body.
Correct.
But women that talk to me tend to be really scared, so they want to know, how little can I take?
Yeah.
But so that brings up a great point.
Well, Janet, look, I can also bring studies that show that testosterone doesn't work. I can bring studies that show that estradiol doesn't work. I can bring studies that show progesterone doesn't work, and bioidentical when I'm talking these hormones, of course.
But they're using too low of a dose.
What you'll find, is in all those studies, they use an inferior dose, and in many cases, they use an inferior form of that particular hormone. So we hit a little bit on how the different hormones should be used and taken. We miss getting to progesterone because we were talking about so many other things. So we'll go back to that. But in those studies, what they did is they gave people such a small amount of hormones
that
it really doesn't make any difference, right? It's kind of like, I use the example of spit in the wind.
Yeah.
I mean, it's not going anywhere, right? And when you look at the studies where they use enough of those hormones, they always have amazing results. And so that is where we're at. I think it takes a
while. I think it took my body a while to figure out what was the best dosage for me, and that's changed a lot over the years.
It does. It does take some experimentation. Now, we have a really good idea of where most women need to start, but that's the beauty of somebody who is experienced like Kim, who can then take and say, Janet's going to be different than Beth. Beth's going to be different than Sally. Sally's going to be different than June. So, and it is going to adjust as times change, as ages change, as activities change. Those levels can definitely change. And that's why you need to be monitored. And that's why we need to talk about symptoms. And that's why we need to look at levels.
And with each of the hormones, mostly we talked about estrogen and progesterone last week. It's not just about how much each person needs, but it's about how we're getting it into our bodies. And so we did talk a little bit about what's the best way to take estrogen, progesterone, and then we'll get to testosterone today.
Yeah.
Can you go over that?
Yeah. So we need to remember, well, let's don't use the generic term estrogen. We're going to talk
estradiol.
about estradiol. Yeah. Because again, we can get ourselves in
compounded, micronized, bioidentical.
Yeah. And the reason that's important to talk about too with estradiol is what I'll call commercially available by the drug companies.
Okay.
It's a tablet. It's a pressed tablet coming from China. And when you look at the studies, it doesn't raise estradiol levels. Wow. So a lot of women, unfortunately, are being prescribed estradiol, and they think they're getting the benefits of it, and they're not. Because it's not going to raise their levels.
Now, I know a lot of people are using a patch. Talk about it.
Yeah, well, again, a patch of estradiol is not wrong. But what happens is it can help what we call the vasomotor symptoms, so maybe the hot flashes, those kind of things. But the studies say that the heart protection, the brain protection, and the bone protection comes from oral estradiol. Okay. The reason there is such again, it goes back to that women's health initiative and blood clots. So the reason that people are prone not to get oral estrogen is they're afraid that it causes blood clots.
Good to know.
There is no study evidence that estradiol causes blood clots. It goes back to the study using pregnant horse urine with, and this is really where the blood clots came from, not even from the pregnant horse urine, if you look at the studies, but when they combined it with a progestin, in other words, an anti-progesterone. Which is the opposite. What they were doing first is giving you women high levels of horse estrogens, from your pregnant horse urine, and then giving you an anti-hormone to your body, anti-progesterone. And there were incidences of more blood clots. But it really, if you look at the arm in this study that were only taking the pregnant horse urine, the blood clots weren't there. Okay. It was that combination. So we're never going to use or recommend pregnant horse urine for a lady. Right. And I am never, ever, ever going to recommend anybody take a progestin, which the drug companies and many in the medical field believe is progesterone.
And so
because
many
that's
women,
what they've been taught.
So many women have no idea what the difference is. They don't know if they're taking progestin or progesterone.
Well, they need to know, Janet.
And then it goes back to a little bit about so many women think they can't take progesterone because they've had a hysterectomy. And we covered that a little bit too.
We did. Now, there's a lot to unfold there. First of all, we talked about estradiol is going to give you the most protection by being oral capsules. Okay. Progesterone also is going to get bioidentical compounded micronized progesterone is also going to give the most protection by being oral capsules. However, there are instances where we use progesterone creams. There are instances where we use progesterone suppositories. So let's talk about that.
Okay.
So if a woman, let's say, and I had this past week, a woman came to me and she said she's 50. She just turned 50. And she said, I'm having hot flashes, 30 times a day. And I said, well, you need progesterone. So I want every woman to hear me. When you're having hot flashes, you do not have adequate progesterone levels, period. End of the story. The guy who I take a lot of these hormone courses from, he's the leader in the world, Dr. Rouzier. He says if a woman's having hot flashes, it's her provider's fault. They're not giving her enough progesterone. So for somebody like this lady that I was talking to, she's going to need oral progesterone at bedtime. But because she's having so many hot flashes during the day, in the beginning at least, she's probably going to need some cream that she can rub on her temples when she feels like she's going to have a hot flash or starts to have a hot flash, or maybe even preemptively preventively to avoid having the hot flashes.
Is that just going to get her levels up quicker?
That's just going to, that's going to bring the levels up quicker, and it doesn't, the cream will not help with the sleep. Mm-hmm. So we don't want her to be drowsy during the day, so we don't want her taking a capsule during the day, so we can use the cream to help with the symptoms, and then use the capsules at night to help with the symptoms and to help her sleep. Now, typically, once we get their levels to where they need to be, their blood levels through the capsules, they can probably then do away with the use of the cream.
Yeah, and their hot flashes
take some time.
And
the hot flashes will go away. Yeah,
they're
absolutely.
feeling better by now.
Yeah, and so that's one really big thing with progesterone. The other incidents where we would use not just oral progesterone would be with a pregnant lady, or a lady trying to get pregnant, or a person who's had miscarriages in the past. Miscarriages typically are just low progesterone because it is the progestation hormone. It's the hormone that is promoting the baby's survival, along with other hormones, but that's the big one. So when you see these ladies who are having trouble getting pregnant, if it's not, it can certainly be the guy, that can be involved, but in most cases, it's low progesterone. They'll call it a luteal phase. Now, you can go to a specialist that'll tell you have a luteal phase defect, and that is translated as you have low progesterone. So we've, over the years, helped, dozens and dozens, if not hundreds of women that couldn't get pregnant by using progesterone suppositories and progesterone capsules.
But be careful if you're using progesterone and you're not trying to get pregnant.
Absolutely, because it can make you, and I warn every woman that's still a childbearing age, it will probably increase your fertility. Absolutely.
It's good for PCOS and things like that.
Really, PCOS is insulin resistance and low progesterone in almost all cases, and often low thyroid, which we hadn't even got to. So let's don't open that box yet. But we can do hormones forever probably and not cover it all. But the big three that we think of when we think of the women are the estrogen or estradiol to be specific, the progesterone and not progestins, and then testosterone.
So let's get into testosterone a little bit today, because that's very controversial with women. A lot of my friends think if you take testosterone, your voice is gonna change, you're gonna grow facial hair, you're gonna get really bulky. And what's your take on testosterone? I know it made me feel so much better when I started taking it.
They have absolutely no clue what they're talking about. That's what I'm going to tell you. Just plain and simple. Now, can we make a woman have some of those issues? Yeah, but we would be using crazy doses, not for what we're talking about. What women experience when we optimize their testosterone levels is, number one, I think, is the way they feel mentally.
The brain fog goes away.
They really are mentally sharp. Mm-hmm. They have back their, vim and vigor, for lack of better terms, how they just feel young and youthful again. I think that's the number one thing that women notice.
Energy for me, definitely.
Energy. Yeah, and that kind of goes with this feeling I'm talking about, of vim and vigor. I call it a mental thing, but they have better ability to make decisions like they used to when they were younger. We think of, most people think of testosterone as, a muscle hormone. It is so much more than a muscle hormone. It is a brain hormone. It increases dopamine, and dopamine is what really makes us feel good and feel like ourselves.
Gives you that pep
in
your step.
When you're younger, you have more dopamine, you know. So
you're less emotional. I feel like, you can deal with things.
Yes, better. Absolutely. It does help. All the hormones in symphony help with that. But so women feel better. They will burn fat much more efficiently when their hormones are all balanced. But again, testosterone is massive for burning fat. It's what we call lipolytic, so it helps the body burn fat. It is anabolic in the fact that it does help the body build muscle. And I think it's really important here to point out that the most important muscle in our body is the heart.
Boom.
And there's more testosterone receptors in a man and a woman's heart than anywhere else in the body. So the idea that testosterone is dangerous or bad for the heart is complete nonsense.
A lot of women don't even realize that we have testosterone already. This is not something extra that we're just adding. We already have testosterone.
Correct.
And that just the levels drop.
The levels, well, the
Mine was
levels
0.
for men and women are dropping
Yeah.
just from the environment that we live in, from the toxins, the plastics, the EMFs, the glyphosates. I mean, it's so much. You know, there's so many things that are going on in today's world. If you look at, and most testosterone studies on this aspect are done on men, but we're seeing it in women. Levels are dropping, I mean, year after year after year for men and women. So this is not uncommon, and part of it is the toxic environment that we're all subject to. It's not,
and lifestyle and food.
There's more alcohol than ever. There's more sugary foods. There's more processed foods. There's 70 cents out of every dollar in America is spent on processed foods. So we have all these things going against us, and they'll say, well, they didn't do it 100 years ago. My parents didn't need it. My grandparents didn't need it. It was a different world then. And who knows, if you really look back, what was their health like? How did they feel? I mean, look, I tell everybody, and this is my key thing. I want to feel 18 every day.
Well, and they weren't living as long.
They didn't.
Now that we're
That's
living
right.
longer, we
That's
need
right.
to have a good quality of life for these later years.
But adding, we talk about it all the time, maybe not so much about adding years to our life, but life to our years. And that's what I think these hormones do, especially testosterone, is add life to your years.
I think that aging is a privilege and aging well is a choice.
Absolutely.
And I think that's a good reason for it. But what keeps coming up for me while you're talking about testosterone, and maybe this has changed, but I can remember that when I first started taking testosterone, if it was for a man, insurance paid for it. If a woman was taking testosterone, my insurance did not cover it.
Well, Janet, I'm going to tell you, get rid of the idea that your insurance is covering any of these hormones. Okay. Because it's not. Okay. Now, it'll cover the ones the drug companies make, but again, that's pregnant horse urine. That's China pressed tablets of estradiol. So that's not what I'm
taking anyway.
No, won't work.
Okay.
If you're looking for your insurance, first of all, I would say if you're in the insurance game of looking for a copay doctor, a copay pharmacy, and a copay hormone, you're not going to have optimal health. You're wasting your time because the insurance companies now control what the provider can order test-wise. They control what hormones the provider can write for you, and then they control which ones you can get filled at the pharmacy.
Which are
and
maybe
then
coming
they control
from China.
What your levels need to be.
Yeah.
So you're boxed in. It's never going to work. And it's really not that expensive to get a good provider, get good quality hormones, and just pay cash for it. Yeah. And the benefits will far outweigh the cost.
I agree. Now, sometimes it takes years to get to that, and then you feel like you wasted all this time and money because you didn't.
Well, here's the problem, Janet. Unfortunately, even a lot of these clinics and providers that say they're doing hormones are not really doing it properly, and they're using these doses in the wrong forms, in the wrong amounts, in these low amounts, and the people don't get the benefits. And so let's just look. I am always about quality, especially when it comes to my health, when it comes to the supplements that I formulate, right? I only want the best. And if you just spend the money up front on the best, you'll get the results and you'll save money in the long run, and you'll be so much more productive and you'll feel so much better. I mean, I literally may have talked about this already on the other 2 podcasts we've done on this. I literally will get texts sometimes at 7, 8, 9, 10 o'clock at night from couples, from women, from men, from both that says, thank you. This a simple thank you. I feel better than I've ever felt. We're burning fat. We're building muscle. I'm down 22 pounds of fat. I've gained muscle. I'm down 19 pounds of fat. I've gained muscle. Our sex life is better than it was when we were first married. We're 50. We're in our 50s. I mean, all these things. I'm better at the gym. I'm I'm more muscular. My body fat's lower than it's ever been. I mean, these are the things that people say. I feel so much better. I can make a decision running my business again. I can, I can think again. I'm clear-headed again. I mean, all these things start to happen, but it is when we maximize and we optimize levels. It's not when we give a little bit. It's when we give enough to make a difference for Janet. It's when we give enough to make a difference for Beth. It's when we give enough to make a difference.
And what's the best way to take testosterone again? Testosterone
needs to be applied topically. And typically for ladies, we would have them apply it to the labia clitoris at bedtime.
Right.
We didn't get into that with progesterone, so I don't think. Yeah, we did. We talked about the capsules. Yeah,
capsules or cream.
Yeah, capsules or cream for the hot flashes, suppositories for the pregnancy related issues. But yeah, testosterone typically needs to be applied topically. A lot of clinics, a lot of providers will want to do pellets. Mm-hmm. I would tell you that the levels will be like a roller coaster.
Oops, sorry.
If you're familiar with Carowinds or Six Flags, you're going to be up on the top of the world one day, and you're going to be in the valley the next day, or not day, but week. And it just, if you look at the studies again, the topical daily use of testosterone is where we are. As a matter of fact,
you're not getting too much. If you're scared you're getting too much, you can back off on the cream. Versus if you get a pellet, you can't back off. It's there for 3 or 4 months.
Well, yeah, and you can't adjust your dose, right? If you get too much or too little of that hormone, whether it's estradiol, testosterone, progesterone, I mean, you're screwed. Yeah. So, and it's surgery, and they can charge more. So I'm afraid that there's a lot of pellet clinics doing it, not maybe for all the right reasons. So I would just encourage women to really think about, again, the hormones that they get, the levels that they get, and how they're delivered. There's a study done way back in 2013, so it blows my mind because nobody, cares or seems to acknowledge it, that says that the incidence of breast cancer in menopausal and premenopausal women is lower in women who get daily testosterone treatments.
Wow.
Okay, so that would be
that
daily.
Study came out in 2013.
December of 2013.
And we're not even hearing about that yet.
Most women are very concerned with breast cancer, right?
Yeah.
1 in 7 to 1 in 8 women will have breast cancer. And so we know that testosterone is what we call apoptotic. Mm-hmm. It's an apoptotic hormone, which means that it helps the body create natural cell death. Cells are supposed to live so long in our body, and then they're supposed to die and be replaced. Right. Testosterone is one of those hormones that creates apoptosis. Okay. Another hormone that creates apoptosis is bioidentical progesterone. So there are also studies that show that women who have carried children to term, and the more children and the earlier they carried those children to term, they have lower lifetime levels of breast cancer. And the reasons I believe that both of these are true is because both of those hormones create apoptosis. So when the cell is supposed to die, those hormones signal for those cells to die. What happens is cancer is just simply a rogue cell. It's supposed to die and it goes rogue, right? It doesn't die and it goes out and starts to create havoc. And so that is kind of a really simple definition of how cancer could start. But you get the point that if we have adequate levels of the hormones that signal to the body, hey, that cell needs to go, then we have a much lower incidence of things like breast cancer. And it's not only true of breast cancer. I just point out a couple studies because we're talking about women for breast cancer. But these hormones can help the body create this apoptosis in all the cells of the body, not just in the breast. So it can lower the incidence of all cancers.
That's amazing. So it's protective. So not just estradiol in the right form and progesterone in the right form, but also testosterone, very, very protective for women. And I always thought of testosterone being more for, fat loss and strength, but to know that it's that protective.
Yeah, and you talked about something earlier, and I should point out the fact that you say a woman's going to get bulky is complete nonsense.
Yeah, it's really hard to do.
Yeah, I mean, Only if they are really, really, really trying and they have a provider that's really, really, really giving them too much. We just don't see it. What we see is women that are thin, but still have a woman's toned body is what I'll call it. They don't look like a bodybuilder. They don't look like like you don't see big bulging muscles on them like you would a man. But what you do see is that they are toned, and you can tell that they're muscular. They don't have that appearance of being muscular. They don't get the hair growth. I mean, we just don't see that, Janet, in the levels that we
Even
use.
if we want it and we try, it's very hard to
It's
get it.
very difficult. And look, any woman especially who looks like that, or man, they're working out a tremendous amount at the gym. Like,
Eating
it's
a lot of
not
protein.
magic.
No.
It is not like, oh, I can just rub a lot of testosterone cream on and I'm going to be
It's
buff.
a lot of work.
It is not true. Those people are really, really working hard.
And shout out to you women that are lifting weights, because that's one of the other most protective things you can do. And muscle
Absolutely.
is our organ of longevity.
Yeah, I know we're out of time, but we need to continue this and talk about some of the other benefits, the muscle building, the bone building benefits of testosterone. So, but hopefully this will kind of get people to start thinking of how important it is to not only balance their estradiol, not only balance their progesterone, but for women, how important testosterone is for brain, bone, breast, heart,
Wonderful.
full body protection.
Yeah. Yeah.
Yeah.
And you get your pep and your step.
That's right. You get your vim and vigor back, right? All right. So we'll talk about it next time.
All right. Cool.
Thanks.
Thanks.